to spend most of I would like to spend most of my time for answering your questions, and hopefully those are related to the topic. No personal questions, please. All right, so here we go. We have, through this webinar, I'll be starting to share 3 procedures. First things first, so you have to identify your stress when it comes to stress, right? The tips for this identification process include 2 things. Step number 1 is to focus on the characteristics of the stress. This might be either positive or negative, meaning that if you're having positive stress, you're enjoying with something, but you're still experiencing through the stress, positive one, yeah, and vice versa. And step 2, you can label how you feel towards it or emotions. So this is the important part. Stress and how you feel can be divided, okay? And this quadrant, so to speak, the emotion quadrant, which is really famous amongst the psychologists, are going to be used. I'm going to go to explain in detail later on, but basically these are very useful for labeling and identifying your stress. Okay, that's step number 1. And step number 2 is as you reflect your emotions onto this emotion quadrant that I'm going to show you later on again. Next, you are able to identify how you feel. And that's what I exactly emphasized in the last step. But moreover, you will be able to distinguish these emotions. But distinguish what? With what? Distinguish between healthy and unhealthy emotions. And these are one of those questions that you may be questioning. You know, if you're having anxiety, for example, people call it anxiety as a disease or as a healthy anxiety or worrisome events. You know, what would be the difference between it? And you will be able to distinguish it through this webinar. Okay. But basically, I'll tell you what beforehand. Conclusion should be that healthy ones are reversible and transient, meaning that they pass with the time. Unhealthy one, on the other hand, stay and exacerbate and becomes uncontrollable. And I'm gonna explain that also in detail, okay? And then lastly, I'll talk a little bit about how to relieve your stress under the COVID-19. All right, so here is, as I referred, the emotion quadrant. And I told you, this is really well known amongst the psychologists to distinguish emotions. This explains how much your emotions are affected with your own stress, like I said. Horizontal axis shows mindset or how you perceive the current stress. This is either pleasant or unpleasant. You can just say positive or negative. And if you're enjoying doing something, like I said, that's positive, but still stress is there. And maybe easier to understand for negative one. If you're struggling with pain against something, yeah, that's negative stress. And that's mainly what people think about stress. All right. Now, somebody said that the stress is like, let's see, the spice of life. Not too much, not too plain, just the proper imbalance. That's what I'm talking about. If you're doing something enjoyable and that's too much, that makes you feel exhausted after all. So good stress doesn't mean that it's good for you if that's too much. Vertical axis refers to, so to speak, energy level, or you can probably say high intensity or low intensity. This is probably easy to understand for you guys. If you know Japanese, genki is literally refers to this level. If you're really genki, you're in high intensity. But if you're like too genki, people start worried about you, right? Something like that. So now you can see 4 quadrants here, starting with positive, high intensity, positive high, and negative high. Can you guys see my arrow here, I guess? Yeah, hopefully.
Yeah,
okay.
yeah, we can see you.
Oh, good, good, good. Negative low, positive low. So please remember these quadrant, okay? Now, here's just an example, all right? But next thing I did was that I've labeled some possible emotions that you would feel in each quadrant state. These are just examples, like I said, but and everybody can try your own labelings, okay? As I distribute this the same slides to you guys, and I'm sure that you have them on your own, I linked to the URL to Miro, which is an online whiteboard software. You can actually go access to it and able to make your own thingies. So here's how to make. For example, starting with positive and high right here in this quadrant, you may feel joyful, excuse me, joyful, excited, or confident. These are all in the area of if you're experiencing some positive stress with higher intensity. Or you might be feeling aggressive than ever, or maybe more energetic than usual. Yeah. And likewise, let's see, negative low could be easier to understand. I labeled sad, lost, teary, as you may be, struggling with pain when you're there. All right. So each quadrant is in charge of certain emotions. And now it is in a big category. We have, let's say, 4 kinds of emotions, so to speak. Like I said, positive high emotion, but positive low. So each quadrant is in charge of each emotions that you can probably label. Okay. Now, if you know Japanese, kido airaku, maybe some of you may know that that's exactly how it explains. Ki, kido airaku. Ki is pleasure. Yeah, pleasure, it belongs to here. Do, kido airaku. Do is anger, literally. That is high intensity with unpleasant stress, right? So do is here. I is sorrow. So literally it comes to here, okay? And raku is, could be enjoyable, could be something, but it means relax or calm. That belongs to here. Now, people say the ideal mental state for positive with low intensity. So people are trying to go reach here eventually by, meditating, to mindfulness and all that. All right. So another thing I wanted to note for this session is that if you go too far on this axis, like I said, that's very concerning or unhealthy. Okay. For example, let's see, if you go too far on positive high, you might be feeling euphoric, meaning happy, or very high that everybody around you would worry about you. Same as omnipotence, so to speak. Omni is multi. Potence is potential, meaning that you can be like a god or goddess that can control everything. That kind of feeling that you're gonna have if you are going too far on this axis. All right. Same as pressure to speech is one of those things in positive high. Okay. Now, some of you might already know that these things I mentioned are what manic state of bipolar disorder would give you as symptoms. So if you go in too far, that becomes symptoms. Okay. And I'm sure that very few of you, or maybe you have never seen people like experiencing going too far like that. So as long as you're not reaching there, you're fine. Okay. Although you might be feeling unhealthy, but it's not pathologically unhealthy. Okay. Likewise, if you're too extreme on negative low, yeah, the suicidal thoughts, as you may already be familiar with, is one extreme emotion that you're gonna have. Same as hopelessness, focuslessness, because you have too low energy to drive or process yourself. Okay. So these are very useful for labeling your thoughts and also positioning where you are at. Okay. And now let's distinguish between healthy and unhealthy, or pathologically unhealthy. As I've already mentioned about the unhealthy emotions already, I'll probably tell you first where healthy emotions are located is right here. Okay, now I told you this is just an example, and everybody could have different emotions in the blue zone, but you already know which emotions are located in this blue zone. These are the emotions that you usually have.
You're getting ready, right?
Sorry.
Oh, that's right. You usually have. And I have to emphasize that it's absolutely okay to be under the blue zone. Do I know what I mean? Do you know what I mean? It's just that it's the one of the very important note that each emotion is located equally in each quadrant, including negative, low intensity. And I wanted to emphasize this again, that it's okay to be in a negative low. Yeah. If you're feeling sad, lost, with triggers, of course, with some reasons, yeah, it's okay to be teary. It's okay to be blue, yeah. And the thing is that the people are trying to avoid those emotions once you're entering those mode. But the question is, why do you have to avoid them? It's not fair, right? And you're trying to be, as long as you want for this area to staying here, if you're positive high, yeah, it's not fair, right? So as I said, Kido Airaku is all balanced naturally, and it's okay to be in any of these areas as long as you're in blue zone. Okay. All right. Now this yellow, and now I think you're getting there. Now yellow part is where I talked about something unhealthy. Yeah, but yellow one could be bluish yellow, or it could be reddish yellow, if that makes sense to you. Reddish yellow is what I referred pathologically unhealthy to enter. Yeah, and it's really hard to distinguish whether this yellow emotions are either bluish or reddish. Of course, yellow emotions were first bluish, but when you leave them there, of course, it's going to become reddish and finally becomes red, or never becomes red for some people. But we don't have any biological reasons that we detected for sure scientifically. So we can't really distinguish. All we have to do is to see or hear their stories, or how much the distress is affected to their daily lives by listening to you guys. So for professionals, it's easier from if you have episodes like that, and I can distinguish them. But for people who have those emotions, it's very hard to distinguish. That's the hardest obstacle. But now you know that the difference between blue and yellow. Yellow, I can define you. Yellow is something that you usually do not have. Okay. Or I can probably say the emotions you do not usually accompany with, or that would appear with unusual settings. Nobody can predict your life events. You may lose your parents, kids, you may have traffic accidents. That's a really major one that you need to be hospitalized. Things like that are very unpredictable, but people get reacted against that negatively or even positively sometimes. Yeah. These are the emotions that you would be able to have for those unexpected events. Yeah. That you usually do not have, right? So you can call them yellow emotions. Or yellow signals, yeah? Now, yellow zone can be reversible, like I said. That would go back to the blue zone as you rest well, yeah? So that these are bluish yellow, like I said, and vice versa, all right? And I will tell you how to distinguish them, either bluish or reddish. Bluish one is temporary, pass with the time, never becomes uncontrollable, meaning they're always controllable. Although you're right in the middle there, you might be feeling uncontrollable, that you couldn't deal with it anymore. But in the long-term perspective, which is for us, it's 2 weeks actually. 2 weeks, the time limit. Within 2 weeks, those emotions are going back to blue zone. It's okay. But more than 2 weeks, or even like exacerbating or becomes uncontrollable, and doesn't pass with the time, it's reddish, and it's time to consult with mental health professionals. Okay. So the last one, how to relieve your stress with COVID-19. Now, finally, COVID-19 is going to be here, okay? Before starting to talk about that, I'll have to explain a little bit about the relationship between your mental health and COVID-19, because some of the studies are already clarifying the relationship between your mental health and the COVID-19. First of all, you may already know that this COVID-19 is literally viral to your mental health. More specifically, it's trying to push you away from positive to negative on the horizontal axis. That's how the COVID-19 is involved with. Okay. More specifically, a number of studies are already showing that the COVID-19 itself is making people more depressed, more anxious, with or without, this is the point, with or without getting infected with COVID-19. So the COVID-19, the existence itself is equally affecting to our daily mental health life. The infection of the virus, though, would also directly exacerbate dementia, quality of sleep, and anxiety. So they are directly and indirectly affecting to our mental health. So what should we do? This is the last slide, okay? Also known as take-home message. It's cliche, but I would like to emphasize to charge your energy. If you're experiencing some yellowish emotions, try to charge your energy by keep to a healthy routine, or sleep, or just slow down with pause, breathe, reflect. These are all what WHO, World Health Organization is recommending to you guys. Or you could reconstruct your perception against stress by refreshing yourself. Yeah. After the refreshment, you may be able to look at the same stress as more like positive stress, because the COVID-19 is trying to push you again from positive to negative. The way you look at it, it might be more positive than what you used to look at it, the same thing. The very important thing I would like to have to note you is connecting socially with others. Yeah, these are very important. Why? Because it becomes a refreshment, like I said. Also, to be able to talk about what you have. It doesn't have to be a problem, or doesn't have to be mental health. By talking with somebody, including your family, friends, like, in here, Nihon Kairari community, these are very effective to charge yourself or reconstruct your perception towards the stress you have. And it will actually promote to get out of the tunnel. Like I said, 2 weeks, it will be shortened by like a couple days or a week, something like that. Okay, by connecting with others, you will be able to kind to yourself and kind to others, of course. Reach out for you will be able to reach out for help, like asking or consulting with professionals. So these are, again, it sounds cliche, but these are the very important part of how to relieve your stress. But I wanted to emphasize this time today is more important thing is to identify your stress, and distinguish them. Those step 1 and 2. All right. If you have any questions, we'll be waiting for you. But this is about it for the slides, and thank you for listening.
Thanks, Dr. Shirai, for that wonderful presentation. Maybe I can, so everyone, please feel free to either raise your hand, ask a question directly to the doctor, or you can post it on the chat. I also have some questions that were submitted in advance anonymously. And if anyone wants to do that, you can do that as well. So let me just go through the, so if anybody has any questions, please raise your hand. If not, let me just ask the first question. So the first question that was posted was, how can a person distinguish when sleep disorder is there and when they need to consult mental health doctor?
There you go. Okay, so sleep disorder is defined as the insomnia, so to speak, that you couldn't sleep for a certain length of time, and which is usually 2 weeks or 4 weeks. Some of the definitions, but anyways, it's weekly insomnia that has to be there if you have to diagnose yourself as sleep disorder. Okay. Disorder, as you know, because I guess that English is your public language and I'm more familiar with my English, but order is sort of like a normal or ordinary setting, right? Normal people can recover from insomnia within a couple days. So longer than 2 weeks of insomnia, yeah, is abnormal or disorder. Yeah. And now a lot of people may be experiencing the normal insomnia after, let's say, participating in events like lives and concerts and parties and all that. You might be really excited and you're wide awake that you couldn't sleep that night or maybe the next night. But after the third night or fourth night, you will be able to sleep to compensate. Your body knows biologically. So that's the difference between pathologically, disorder, or you couldn't just sleep for a while.
Yeah.
Sorry to interrupt. Actually, I would just like to add on a question to this specific thing. So this is just my first-hand experience. Some of my friends consulted me. So it's like it's about some kids. So kids, they are not sleeping well and they are getting angry with the parents overnight and all. So it continued, I think, for many months and all. So at that time, they were worried about whether they should consult with the doctor or is it
Good
a
question.
part of the development of kids.
Good
So
question.
yeah, how the normal people can relate it, because it's just a first-hand experience with some friends
That's right.
asked. Yes. So how we can distinguish any good tips of the
Yeah, very good
development
question there, Jason.
yeah,
Very good
yeah.
question. The answer should be depending on their months or age. Before 6 months, it's okay to wake up numerous times in the middle of the night. Why? Because they have to be fed. Yeah. After 6 months or so, they will be starting to roll around or like start to move during the nighttime. There's not actually certain numbers that they have to wake up or they have to sleep. Yeah, makes sense. So it all will be depending on the age of the babies when it comes to the baby's sleep quality. And now, where to consult with? It's a very good question. If you have some, let's say, concerning facts, not only about sleep, but also the typical consultation is about skin problems, like diaper, for example, and crying during the night, including, of course, insomnia. And I don't call it insomnia, but anyway, sleep problems, that skin problem, and also about breastfeeding problems. Yeah, feeding problems. These are three major issues. But you can either go to a pediatrics department. Yeah, you can directly go there if you're really concerned with, or just to give you an advertisement, we have actually the online consultation services. English might be available for some of the doctors, some of the pediatricians. It's called Shonika Online. Yeah, and Shonika is pediatrics and online is online. And if you want, I'll give you the link if you want. And actually,
Yeah.
my wife is part of that company. So yeah, that's also one of the options that you can go. They're going to decide for you to give you advice, of course, to whether or not you have to go to the hospital. So it's better than just going to the hospital, because going to the hospital is a lot of labor cost. Yeah, for mom or dad, of course. Yeah, but before going there, staying at home, you can just consult with professionals online. That's very helpful, for sure.
Okay. Thank you, Sensei. Yeah.
All right. So yeah, should I go on to the next one though?
Yeah, let's do that.
Yeah. How to stay motivated and have energy when being stuck at home all the time. Now, this is very typical question, and don't worry, I don't blame you guys. But again, COVID-19 is itself is viral, like I explained, and not only that, because of the COVID-19, people started to work remote, staying at home. That's very stressful. Why? Because you're just literally sitting here all day long, looking at a monitor like right now. You feel like you're talking to somebody, but you're actually not really, talking to somebody for real. Staying with the family members might be stressful, especially with kids, maybe wife, husband, maybe 24/7. Yeah. These are all natural. The first thing I want to emphasize is that's very natural to feel stressed out. So a lot of hacks are there against that. One of the hacks I can recommend you for now instantly is that you go out for a walk for 10 minutes or something every 1 or 2 hours you're working. Yeah. And now you might be a waste of time to do so, but think about it. I mean, you spend, I don't know, 30 minutes or 1 hour to commute to the company before, right? So using those time for allocating for your bit of exercise in each hours, and that doesn't really change your proceedings for your work, I believe. And yeah, likewise, do something as a routine, like keep to your routine work is one of them. Like, let's say for your lunchtime, yeah, you decide yourself to lay down on the bed for 10 minutes. That would work for that kind of stuff. Or let's say going out for a drink, I don't know, in a park or something with your friends once in a while. The thing is that you have to find your own routine. Yeah, it doesn't have to be something that I mentioned. But if you keep going, sticking to it, then that would make yourself relieved in a way, because people like to do same things at the same time. And COVID-19, staying at home, things like that are unusual, right? So stick to your usual routines. If you don't have any, please make them. Yep, that will be my advice. And again, as you noticed, this has nothing to do with medicine. So don't worry. Everybody equally is experiencing or suffering from COVID-19. All right. Okay. If you have further questions, you can just ask me, okay? Interrupt me, please. How can we overcome the anxiety which actually blocks the ongoing task at the moment? That's a very, very good question. Very typical one as well. Now, they have probably two keywords in here. Anxiety, of course, and blocks the ongoing tasks. Blocks the ongoing tasks, meaning that this guy or this gentleman or lady must be stuck, or the time has been stopped by having this anxiety. Yeah, people call it, in other words, people call this, may call this rumination, what we call. Think about the stuff that you failed to do in the past, or I shouldn't have done this, done that, or maybe I should do this, and that way it might be better than what's experienced and all that. This is what we call rumination. And according to the psychological studies, a lot of them are having the negative comments towards this. Rumination doesn't create any productivity at all. So what you have to do is, again, you do something else to refresh yourself, refresh your mind. Although you might be back to the rumination back again if you do something else and come back, but still, it's better than just stuck on one thoughts in cycle. So that's probably how we do. Now, if this one is talking about anxiety or worries, yeah, and that doesn't really go away from your mind or from your brain, that's another story. If that's going away or past with time, you just leave it there for a couple of days. It might be very, very struggling for you for those couple of days, but if that goes away, you're gonna just get back to be in a blue zone. Okay. However, if the anxiety is trying to control you, yeah, I'm always talking this topic to my patients in the clinic that you are like a marionette doll, yeah, with the strings, yeah, and usually anxiety is controlled by you. It's like that, right? But if that's reversed, yeah, anxiety is controlling you, that is the time that you guys really have to come to the clinic, because that's very, very unsafe feeling psychologically, and you're going to lose controllability, and that is also scary because you don't know when to have the anxiety, if that's going to be reversed. Yeah, the relationship is going to be really, really reversed. And as long as you're there, you're controlling the anxiety, pass with time, again, reversible, controllable, they're all fine. Okay. All right, so how can a person, next one, how can a person with sleep disorder is there, oh, this is the same question as before, nah? Okay, I sometimes do overthinking. There you go, overthinking, nah? Rumination, remember? How to stop overthinking? I should like to stop involving in multiple tasks during work. Okay, this person must be very, very talented in work. I guess that you can probably have 3 or 4 steps away from the current jobs, meaning that you can proceed or foresee your tasks, I guess. But sometimes this simulation, yeah, might not be right. That makes you feel more worried about the scenario, because what you think is right about the future might not be right for real when that really comes. So I would probably say that just slow down. Yeah, maybe like not 3, 4 steps forward, but maybe like 1 step forward to go, and focus on now and here. Yeah, that'll be my advice. That way, in the future is made out of here and now, and the future that you're thinking is coming anyway. All right, so how to deal with stress with toxic workplace, or a workplace that I consider toxic, okay? Reasons for considering as toxic is that doesn't like current position. Okay, so this person doesn't like the current position or job assignment, and when conveyed to the management, to the manager, is that what it is? Probably only another ignorance from the manager. Didn't even ask about the problems and blah blah blah. And number 2 is to neighboring colleagues have assignments aligning to my area of interest. New employments as well as transfers are done at the departments, all while I'm still assigned to something. I guess this is like assigned to the boring job or unwished tasks, I guess, I'm assuming. Well, I don't know. I mean, you can probably ask your colleagues or company. This would be my answer, but this is too irresponsible. So I would, in my perspective, this one is a very good example of how you look at it. The thing is that when you talk about something like this, the subject has to be watched, okay? You have to pay attention to the subject. The subject on this kind of question is always not I, but you. Did it make sense with you guys? Yeah? Now I can say, you don't give me the satisfying jobs. You are having an utter ignorance from for about what I'm doing or what I'm working for. You neighboring colleagues, yeah, have assignments that I wanted to get assigned, yeah. You are assigning me to boring jobs, yeah. It's always you, yeah. Now the point is to listen to your voices, meaning I voices, ne? In this case, ne? So I don't know, well, this is supposed to be anonymous. So I'm just gonna say Mr., all right? I might be Miss, but let's say just Mr., all right? So the Mr., I want you to focus on your own voice, not their voices, okay? and so to speak, back voice of the voice is the key. I hope it makes sense with you. It's usually I messages. Nah. The front voice is usually you messages as I notify you. All right. And passive message is also one of the key points. These are all passive, right? I am done by you. Yeah. I am assigned by you, you know, something like that. That kind of sentence is always like you message. Yeah. So through the you message, you have to focus on your own thoughts. How do you feel about it? Yeah, maybe I want to assign more satisfying job, or I don't know, it might be something else. But um, after listening to your own voice, you may be able to know your emotions, and maybe you can start labeling your thoughts and emotions on a quadrant and see how how much intensity you have, or how negative or positive you're located. That may be the start of analyzing this question. Yeah, I hope that makes sense to you if you're there. All right. So the last one, how to take out our anger, frustration during this COVID time. Okay, this is a very good example. Okay, so I'll tell you what. Excuse me. Again, using this quadrant, okay? Angry, yeah, is here, okay? Irritable is also here. Irritable, anger, I don't know, you might be like angry all the time in blue zone, so it's just an example. But anger should be lowered to the blue zone by refresh yourself, charge yourself, yeah? So it depends on which color you are at. Yeah, now going back to the question, take out our anger, frustration during the COVID time. For that, you might be easily getting anger or anxious or even irritability, because I told you COVID-19 is push you from right side to left side. Yeah. So try to relieve your stress as much as possible. That'll be one of the advice. It's cliche, but the other advice should be that try to go back to the blue zone. It's okay to be irritable. Yeah, but not angry in this case. Yeah. This is probably the temporary goal rather than just diminish the anger. Yeah. Now, a lot of people actually getting wrong about the anger has to be happier by positive energy with high intensity. Again, as long as you're in a blue zone, you're okay. It's natural. That's one of the, sorry, that's another advice for you if you're interested in that part. All right, let me reload. We have about like 10 minutes left, nah? All right.
You can open if anybody has any questions from the live audience, probably ask them as well. If not, maybe I can ask some questions. So I think, maybe I'll ask one question from my side. So I think a lot of people are also dealing with, especially back home in India, they've been dealing with, passing away of relatives unexpectedly, like immediate family, close family, friends, and especially it's quite distressful. And I guess maybe people in India are especially emotional when it comes to death. So what's a good way to think about that and handle that?
Let's see. Isolation should be avoided as much as possible. That's one of the major things to do. This kind of community is very, very crucial, especially under the COVID-19. I can assure you that. For the Japanese community, we don't have such thingies. Yeah, so people, especially in city side, are becoming individual more extremely, that there is literally nobody to talk to in the day, especially in the younger generation, actually. So again, to socialize as much as possible, like mama tomo in Japanese, for example, if you're a mom and if you have friends with kids, talk together. Yeah, talk with like anything. Yeah, if you're at nursery, you might have time to talk with your friends, that they're picking up, like at the same time with yours. You can talk a little longer than just say hi. Yeah, something like that is very, very, very important, because through the conversations, they might notice that, how you're doing, and you might be okay or not. So amongst all these, I would probably say, connecting with others and below are the most important part of it for the tips to get rid of the COVID-19 stress.
Okay. Thanks, Sensei. Any other questions from the others? What I'll do is, everyone in the meeting, I'll send the link to this, the question sheet. If you want to just anonymously type your questions, that also is fine.
Yeah, in the meantime, I will just ask one question, because like we have a volunteer team for the Corona COVID support and all. And so we support the such many questions actually. In fact, we received many kind of questions during like last 1.5 years.
Okay.
But I particularly notice some people, they are more worried about whatever happened in medicines. And for example, if a new drug is found, they say, can I get that drug? And like I understood from their perspective, but sometimes I feel the count of they look at the graphs being too much worried about this. So I don't know, like maybe it's normal, but some people, particularly I could see that they're more anxious about these drugs, graphs, number of deaths, the rate of positivity, everything. So what is your proper advice? How we should look at the COVID situation in the world, or in Japan or India? What we should care more? Like how much distance we should keep on the deep deep impact of the COVIDs.
Okay.
Yeah.
Medically speaking, COVID-19 will probably become like influenza. So it's a seasonal flu, but more severe than that. Okay. Now, how they're going to do, and the pharmaceutical companies are trying to what we call boost vaccinations. Is that you're gonna get something like once a year or twice a year, every single year, they're gonna get vaccinated, and that way you're gonna get rid of getting severe symptoms of the COVID-19. And we're just about to start that steps, and right now we're actually suffering from all the mutant subtypes of the coronavirus that's even like more infectious amongst kids and young people. So virus, on the other hand, is also getting, strong. Well, not stronger, but I mean, it's getting different. Yeah. In order to do that, the pharmaceutical company is trying to invent against those subtypes. And that's one of them, okay? So the world that you see in a couple of years is something like that, like what you do for influenza vaccine, yeah, that you do in winter, okay? Now, AJ-san, what did you say about the drug? Drug for what? Drug for...
No. I mean to say that people reading too much and getting anxious or more concerned about whatever happening over the world. I mean,
okay.
That's
about
the point.
India, right?
Yeah, about the India, about for example, side effects of the drug, new mutants coming. So what will happen to me? I mean, this is also a first-hand experience, because I want to be compassionate and care to my friends, but some guys, they just keep on thinking about this.
Okay.
Yeah.
Gotcha.
So
Mm-hmm.
so ideally in our life, where we should, as you said, this quadrant graphs and all, maybe there is a line like what we should care more, or
Good question.
where we
Okay.
should stop. Yeah.
Understand now. Okay.
Yeah.
Now, let's say for now, okay, for now at the moment, be careful with your elderly people. As AJ-san, stay away from them. That's one part. But other than that, you don't have to be so much worried about it by contacting. Of course, standard precaution, like washing hands, wearing a mask, are very important, and you must do that no matter what. But otherwise, you don't have to be so sensitive about it. Okay. Now, if you start to read articles about the COVID-19, if you start to worry about one article, usually the news soft has a you guys know it. It's engineered. It's a cookies that actually picks up the articles that's related to the articles. So the more you're worried about it, and if you keep going, it makes you even more worried about the information that you're going to collect. So you're going to get biased through the readings that you're unconsciously reading. So I would say stay away from the information for a while. It's okay. You're not gonna die, for example, without reading articles. So if you start worried about reading it or watching the news, away from the information. That's one of them. And the other thing is, what's that? All right. So the other thing is that, social distance thing. Is still necessary, especially with elderly people again. But since we're going to have vaccinated more and more, you don't have to be again worried about that much anymore. And listen to what government says. A lot of reputations, a lot of criticisms going around against the government, but government has been doing a great job. Yeah, at least medically.
Thank you, Sensei.
Yeah, no problem.
I think we had some more questions coming in. I think Biju was trying to speak. Biju? Biju, were you saying, did you want to say something?
No, Shailesh, no.
Oh, okay. So Sensei, I think, in terms of, I think I'll ask one question on behalf of myself. In terms of like I guess even kids are kind of having to deal with this, in very different ways. So, and a lot of kids are, mostly at home and they should be playing outside, but they're not. And there's a lot of pent up energy that they have. And, as parents, it's quite hard to, keep their energy, contained within also the house. So, that also kind of adds to the stress. So, how do we manage that family situation with,
Good, very good question. Kids are so far unlikely to get infected. They're the most tough people, actually, amongst all the generations, I guess. So go to the parks. It's okay. Do some refreshment for them, their priority. Also sleep is one of them. You can actually sleep with the kids, not necessarily in the same room or same time, but kids' sleep cycle is getting more like similar to the adult cycle as they get older, right? If you get stressed out, you need more charging time. So sleeping together, like on the weekends they have hirune, right? Like a nap, right?
Yeah.
You can also do that the same. That'll probably make your life healthier. Yeah, something like that. And for nursery, they're always like pay attention to COVID-19, of course. But as a matter of fact, it's more risky to get infected with adenovirus or rhinovirus, or even some other viruses than COVID-19 for kids. So they are also, let's see, they are very common, seasonal. And you don't have to, so sensitive about that COVID-19 in particular. That'll be my answer.
Okay, thank you, doctor. And I think
No problem, no problem.
maybe we have time for a few more questions. Maybe a couple of questions. Does anybody want to come onto the mic and ask a question? So I think maybe one thing I also missed from your presentation was what's the best way to kind of reach you, or any English speaking like mental health professionals in Japan, because I think a lot of
Right. Yeah, good question. I'm working for Yotsuya Clinic. It's in Yotsuya.
I see.
And you can contact us here. Unfortunately, I'm personally like closing my first visitors because they have to wait for 4 months. But there's other days available with a different doctor. Yeah. You can either come here or there's not many actually English speaking doctors who are able to do the mental health thing. So you can actually consult with me first by contact us here through my website.
I see.
Yeah. Yep.
Thank you. Great. Yes. Thanks for sharing that.
Mhm.
And I'll share the links later on to the.
Oh yeah, please.
Yeah. Thanks for sharing that.
Yep. And lastly, I want you guys actually hopefully that I would like to get feedback. Okay, both positive and negative. And I'm gonna make a questionnaire, and maybe I'm gonna send it to AJ-san first.
Sure.
within a couple days, so that hopefully everybody enjoying this webinar can give me the feedback to improve the quality of the webinar. Please, this is my favor to ask you.
Sure, we'll be glad to do that.
Yeah, I appreciate that. Yeah.
I'll also be sharing the slide that you shared.
Yep.
As you requested, I'll be sharing it with all the participants, and also this video will be going online. So if those who have missed can also watch it offline.
Okay. All right. Good.
I'll also include the links.
Okay.
Yeah.
Gotcha.
So I think we have reached the hour. So yeah, if anybody has any other question, we can take maybe one last question, or else we can end the session here. So if there are no, we see the chats. No, I don't see any hands raised. So yeah, I think we can probably conclude here. So yeah, maybe Ajay, do you wanna? So I say a word of thanks. I personally like to thank you. It was a wonderful session.
Thank you.
Very, very informative. Ajay, do you want to share?
Yeah, nothing. I would just like to say a vote of thanks to especially the sensei, because as he said, I have researched. I mean, I know especially for international community, it's very hard to find an English speaking and a doctor who can understand the feeling of expats. So I think I mean you are very helpful to give spend your time to all these community members, and probably, as I said, because of the social stigmas or something, I mean, we expected more participants, but anyway, I think this message will go to all members. And thank you once again, doctor, and all participants for this joining this meeting. And so see you. I mean, we will keep in touch. And of course, our Nihon, you have given the link to contact you through your diversity clinic. So I think it will be very useful for all members in future. Thank you very much.
Thank you, Ajay-san.
Yeah.
It's my
thank you, and thank you, Shailesh-san.
Yeah. Thank you, everybody.
Thanks
thank
for all your work.
Thank you.
Yeah.
Thank you.
That.
Thank you. Thank you.
I'll stop the recording.
Yeah. Thank you. Bye.
All right. So bye-bye.
Bye-bye. Bye.
Bye.
See you again.